and we're at 9 o'clock, and so we're ready to go. Maura, is it to you?
Good morning. We should actually have a panel of folks joining us today. So I'm wondering if they're hiding on me. Nope, I'm starting to see them. All right, perfect. Got Cole, we got Ben, Cindy Gordon. So let me go through, get us started. I'm looking for Dina. I don't know if she had a chance to join us. Hi, Dina. Okay.
How are you?
Okay. Thanks. All right. So, Jay, thank you very much for inviting us. And on behalf of the team, I want to just thank everyone for really giving us some time today to speak at your program. My name is Maura Snyder. I'm the Vice President of Operations here at Newark Wayne Community Hospital. And over the past year or so, Jay and the team and Jill Harper, we've been having conversation about how we as the hospital and the community, along with Rochester Regional Health, can help cover and fill some of those healthcare gaps that we're seeing with our kids, with the parents, and with the schools. And so I'm really excited today to introduce this team that's going to talk about our school-based telemedicine program that we have through Rochester Regional Health and how it may be able to meet some of these challenges that we've talked about over the past year. So with that, let me introduce our presenters for today. We have Dina Gray, who's our Senior Practice Administrator for our Primary Care Institute, along with Cole Nardi, who's our Director of Telemedicine for Rochester Regional Health. In addition, we do have our panel who will be available to answer questions as we go through the presentation and after. Dr. Beth Orlowski is our Chief of Pediatrics for Newark Wayne Community Hospital, along with Wendy Fisher and Brandy Rybrick, who are our practice managers who oversee our pediatric programs and internal medicine programs within Wayne County. We also have our telemedicine team, Ben Snyder and Cindy Gordon, who are joining us. And from the hospital standpoint, we have Christy Rollo, who is our Director of Operations, as well as myself. So with that, I'll turn it over to Dina so she can kick us off.
All right, thank you for that fantastic introduction. So again, just want to thank you all for allowing us to come speak to you today. We did have a chance to talk to Jill Harper. Wonderful conversation about how we may be able to support you in future needs. So just a brief overview from an agenda standpoint, we're going to talk about where we are as far as RRH in Wayne County, some of the programs that we have there, some of the statistics from our pediatric side of the house. And then we're going to move into telemedicine, which Cole Nardi will present to talk about that at RRH, and then our use cases, as well as our Tyto clinic and the new exciting equipment that we have for telehealth, and then next steps. So just a brief overview. I know you all are familiar with Rochester Regional Health, at least in our Wayne County area, but we just wanted to give you a brief overview of the system as an umbrella system. So we do include 5 hospitals: Unity, Unity Hospital, Unity Health Clinic, Clifton Springs, Newark Wayne Hospital, and then Rochester General Hospital. We are 16,000 strong and growing with RRH, continue to grow even in 2020, dealing with our pandemic. I think we had about 13 acquisitions from what we have gathered across the system, which is just fantastic. Other systems, unfortunately, have not been quite as lucky as we have at RRH, so the growth continues. About 2,500 medical staff, and we can go through all of these, but 1,600 system volunteers, 936 long-term care beds, 8 senior living facilities, some of which are right there in Wayne County, 370,000 behavioral health visits, which continues to grow with the pandemic, as you can imagine, and I'm sure you see every day in the school. 87 primary care and ambulatory locations, 1 million clinical tests and trials. We have 54 labs, sites, and 245 plus ER and emergency room visits, and this is in 2020. So just a little bit of background on some of the statistics that we found there in Wayne County, which I'm sure you all are very much aware of. But in Wayne County, childhood obesity rates about 37%, 42% amongst the low income children, right? 35% of the students do not have an identified primary care provider, which is somewhat concerning from a continuity of care basis and making sure that we're really managing that care well. Transportation is one of the issues that we have definitely run into in the Wayne County area. We will have Wendy Fisher, who's our practice manager for both Sodas Pediatric and Newark Pediatric, talk a little bit about what they've done to help support the pediatric patients there and their parents to get them to the care that they need. And then as far as some of the statistics that we have seen, more than half of the 8th, 10th, and 12th grade females reported feeling very depressed and some sad on most days, which is about 38 to 40% higher than the male pediatric students that we've seen in that area. So I think mental health is a huge part of the care that we need to provide, which is part of the overall collaborative care. So just a little bit of background about RH and Wayne County. We currently have 12 practices in the Wayne County area, 2 in Lyons, 2 in our Wolcott area, 2 in Williamson, 2 in Macedon, 3 in our Newark area, and 2 in Sodas. That includes 31 providers across Wayne County, a total patient panel of over 40,000, and a pediatric panel of over 10,000. So we're very familiar with the Wayne County area, very much enjoy the patients there. It's a wonderful area and we're so happy that we're able to serve the community. We just put a little picture of our Newark pediatric team down there so you guys can start to put faces with names. People and folks that work in our community and live in our community, and we're definitely there and devoted to the community and helping support that. I wanted to add just a brief slide regarding our providers. This is just a small panel of our providers across Wayne County, because obviously we have 31. That would have been a very large slide. But we've got Dr. Logfrin, who is new to the RH system. She's actually in our Wolcott pediatric office. She comes with a large amount of experience, about 11 years managing pediatric offices. And I believe it was out of state for a while that she was there, but a wonderful addition to our Wolcott Peds team and is very, very well received from our community. We've got Dr. Tavares, who has been with the system for some time. He's a family medicine provider out of our Lyons office. Dr. Bjorseth, who's out of our Newark pediatric office, and then our own Dr. Orlowski, who is on the panel today, who is our pediatric lead in the Eastern region. So I wanted to add a picture of you, Dr. Orlowski, just so they can put a face with a name.
Yeah, that's an old picture. It's from 16 years ago. I don't like it, so.
So some of the current state of where we are, right, in Wayne County, as we talk to Jill and some of the other issues that we're dealing with in our telehealth-based programs across school systems. Obviously, COVID is presenting a very unique challenge for the school districts, dealing with the regulations regarding that, and the COVID testing and timely turnaround of COVID testing. So certainly something that we want to discuss today and collaborate with you on. The school nurses see about 60 patients a day. So the nice thing is with that, you've got the school nurse that everyone appreciates and feels comfortable with. With the telehealth model, we have direct access to our our pediatric physicians right in the office to be able to help manage that care for the patients. You can see a few items that we can manage via telehealth, which I know Cole will dive more into with help of our panelists. And again, a large amount of students without a primary care, which is concerning, right? As we look at the statistics and knowing that they do need that collaborative care model, we have the capacity and we want to work with you to get them that care. And then I will turn it over to Wendy Fisher just to talk a little bit about some of the transportation programs that we have put together to make sure that our folks in Wayne County, parents and pediatric folks alike, can get access and be able to be transported to the office for their visit. Wendy, are you there?
Wendy, you may need to do *6 to unmute.
Hi, Wendy Fisher, Newark and Sodas Pediatrics Practice Manager. Good morning. Actually, I'm born and raised in Newark and graduated from Newark High School. So right now, we have about 75% of our patient panel is a Medicaid-based insurance. for those patients, we are able to use a medical answering service. If the transportation, we do have to arrange those rides. There's specific conditions, but we are able to provide transportation for our patients. Oftentimes, though, it can be unreliable for them what time they're arriving, what time they're being picked up, but we do accommodate those patients. Right now, it's working out very well, but as we head into illness season, we hope that we're able to provide those services in a timely manner. But patients do respect the fact that they may have to wait a few minutes, and we are able to accommodate them.
That's fantastic. Thank you, Wendy. And each office has set up a different option to be able to help with transportation to meet those needs. Obviously, as we're talking about telehealth, that's a way to deliver care without having to deal with some of those barriers that we are currently having to deal with getting our folks to the office. So with that said, if there aren't any questions, I will turn it over to Cole to start to talk about our telehealth initiative.
Hey, good morning, everybody. So obviously telehealth is it's something that's become a in vogue buzzword lately, but it is something that Rochester Regional has had in practice for quite some time. We actually initially started doing telehealth at RGH in 2005. So way back when, you can see how the technology has changed. We had kind of a roaming robot here with video connection, helping to provide consultative outpatient services between Rochester Regional locations. Lately, and certainly this is something that Rochester Regional really got into in 2018 to be able to do direct-to-patient video visits. In lieu of COVID-19, this is obviously one of our biggest mediums for video visits. So we've completed over 160,000 video visits year to date. Obviously, starting in the March and April timeframe to really ramp up. Those are coming through at a couple of different platforms. Our primary platform is our MyCare patient platform. And one of the benefits of that is it has the ability to offer an after-visit summary, after-visit summary and a patient survey to all patients. So we've found a tremendous amount of positive feedback from our patients. So over 98% felt that they received sufficient care via video. 96% said they would use video again. And I think it's 96% would actually recommend to a family or friend. Obviously, one of the big caveats there is we know people were getting adjusted to not being able to see their provider in person. So a lot of the feedback that we got were comments to the effect of, "It was great, thank you for accommodating, but it's not quite the same as an in-office visit." So that's where we're really excited to kind of introduce a point of care peripheral, and specifically something that we can tie in a clinic, in a school nursing office as well. So TitleCare is a product and a company that we recently formed a partnership. This is a tool that will be a peripheral for a video visit. It will allow the provider to hear heart and lung sounds. It has some special exam cameras that are a little bit more high resolution to see skin rashes, and an otoscope that can be used to look into the ear. So really cool product. So basically what the school-based version of this will look like, it's called the Title Clinic is the product. It's a ruggedized version of the Title Home tied to an iPad with a docking station. It comes with a blood pressure monitor and that kind of poor Title device as you see here. So again, with it basically allows, and it'll help, the next slide will show kind of the provider view, give a little bit better feedback, but it's that camera, it's got a thermometer built in and an otoscope and stethoscope for the provider to really have an enhanced video visit. That's certainly not quite the same as being in the office, but a step in the right direction. So the provider actually is able to kind of guide through these different examinations. So they can guide the patient through lungs and heart and heart examination, and then be able to switch to a camera function to be able to see in the patient's throat and in their ears, as well as switch to kind of the temperature function. So we did put in for a grant with Wayne County and hopes to be able to provide these in many schools. We unfortunately were not awarded that. However, Rochester Regional has really found the value in this tool, and we are moving forward regardless of grant funding. We do think there is an opportunity to start partnering with Wayne County, and COVID certainly, COVID assessments are certainly kind of high on the list for things that your school nurses now have to work through where they previously didn't. So we thought a partnership with Rochester Regional and Wayne County could allow for a kind of a rapid assessment and triage for patients who present with acute or possible COVID-related symptoms. So we certainly know, the benefit would be if this is a Rochester Regional patient, we could potentially be able to give a alternate diagnosis and be able to send that child back to their classroom if it was appropriate in a quicker fashion than relying on that patient for having to go to their provider outside of school. So I think our proposal at this point was, we'd really like to, we have at least 3 Title Clinic devices that, we'd be happy to partner with Wayne County if you're interested. Our thoughts were providing COVID assessments and acute care for students who both are Rochester Regional primary care, have a Rochester Regional primary care provider, and for students who have no primary care provider. We can go through the process of assigning ourselves as the primary care provider. We can have video visits with our local Rochester Regional providers and help, provide better care for our patients in the school setting. So I think our next steps were, if we're interested, partnering together and kind of building out a comprehensive use case. There's a lot of questions within the workflow that we would need to define. There are consent forms that would need to be attained ahead of time for a video visit and the parental consent. We'd want to make sure that we formed a partnership with Wayne County so that we could have the proper parental involvement and follow-up and workflow to make sure that parents are notified of a visit if they're not able to be present for it. And then kind of working out a workflow for how we can schedule Rochester Regional provider availability. So the project manager in me kind of said as kind of our next steps would be to kind of find this group and define our project plan and determine some pilot sites and success metrics for starting potentially in the spring and perhaps even kind of doing something larger in the fall when we've got the summer to plan a little bit more of a cohesive strategy. So that was it. I think our intention was to really kind of open it up and try to get as much feedback as we can and answer what questions you have.
Thank you, everybody. More anything else? Or I've got a question, and then I can open up to other questions. Is there anybody else from the panel have anything else to add before I open it up for questions?
I'm just grateful for the opportunity. I know it's going to make a huge difference for the care of our children and for the just the relationship building for our families as well, to help take one burden off of them, that, to build the partnership between the community and the school. I'm very grateful for the opportunity. Thanks,
Jill. So my question first is actually just a little bit, hopefully not too tangential, but can you speak about dental as well? Like what options may be for dental? Is that a whole different component? Is there a way to wrap that? I'm just wondering about that.
Yeah. So I think we're open to kind of discussing and fine tuning what the needs are. We certainly heard before the call. Behavioral health was something that may be top of mind as well. We do have some of our dental providers are providing video visits, but it is very low in frequency. But certainly we have the ability to bring in those folks into the conversation if that is a need for Wayne County, for sure.
So that dental was my first question. Other questions can either go into chat, or you can come right off of mute and ask a question.
One of the things that I keep mentioning that's just important, I feel, is to also keep the parent involved as much as possible. You know, I've worked for the last 20 years to help advocate for the parents to be the child's advocate. And the one thing that I just don't want it to be something where the parent sends their kid off to school and just knows that we're going to educate them and also take care of their doctor's visits. I just want to come up with a plan so that the parent is involved and still the best advocate for the child.
Yeah, that makes a lot of sense.
Yeah. We would agree. And I think that's always the goal, right? When we're dealing with the medical care of the children, is to involve those folks that we know are going to be impactful and influence in a positive way. So we appreciate and we look forward to the same thing.
And that really echoes a community schools approach, which is place-based and person-centered, right? So what does that look like, that parent involvement look like for the student? And what does it look like in Sodus as compared to Newark, as compared to Marion? Maybe different. And that's also where hopefully we can get the interagency report, whether it's a family counseling services advocate, whether it's a Wayne behavioral health clinician, but there can really be a good wrap team there. So it's, that information sharing. Brian is asking, Brian Brooks from Palmac is asking, what is the biggest barrier in getting telehealth in all schools? And you can, if you can't go right to the biggest, any barriers that schools should worry about, or anything that you can see that will be an implementation concern, just to start to say this is, any of those would be great for sure.
Yeah, okay. So I can't speak for the whole Rochester Regional team, but I would say, the traditional barriers in being able to do this are understanding and defining what our use cases are going to be, like what are we going to be seeing, the kids for, and understanding, and building that out so that we can make sure we have our providers that can be available at the time needed, right? So, so the providers that we're talking about using, for this are Rochester Regional providers located in Wayne County. So they are local resources, but they are still seeing patients in the offices. So just, I think, partnering with, with your leadership and Rochester Regional, I think we can come up with something that fits the needs for both sides. And then, working with Dina to kind of come up with a provider staffing strategy to make sure, if we say, we're going to have a 2-hour block where, we can see patients and, just kind of working through that scheduling process is probably the biggest barrier. But it's not something that can't be done. It's just something that, we got to bring the right people to the table and kind of talk through it. The equipment, Rochester Regional has leased a number of these for 2-year time frame. So Rochester Regional can bring the equipment to the table. It does require being on Wi-Fi. So our goal would be to be able to use Wayne County Wi-Fi, and then we'd be able to have a secure video visit through the tool. But we could also work on some other wireless hotspots if needed, depending on the service that we get within the school. So that's certainly a component that we would have to do. But I think the biggest thing is defining the use case and figuring out, what our demand is going to be so that we can meet it with the appropriate staffing level.
Thanks. So Nikki's got a question from Marion. Would you only see the Rochester Regional Health students and possibly those without a PCP? Would other students still need to go to their own PCP? So I guess
yeah.
I can speak to that, Cole. Yeah,
Sure.
so for the initial pilot project, from a billing concept as well, we can only see our Rochester Regional primary care patients that are already within our network, or patients that don't already have a designated primary care provider. This is also, and Dina, please step in, and the rest of the clinical team, it also helps with the continuity of care. So, I think that is a limiting factor, but this is kind of our starting off point as we look to see how we can help the community as a whole. But the other one we have also started conversations with kind of in the background is the Finger Lakes Community Health Team with Mary Zelazny, because they do have a lot of our community kids that definitely have transportation issues and just engagement issues. So we are having conversations on partnering with them as well.
Yeah, and I would just add to that more. That was great. Certainly, if that's something that we want to look in the future, I think the team is open to it. Just as a pilot, process to start, that was kind of the avenue that we were going from a billing perspective. And then as far as scheduling, we have a handful of folks that are ready and very willing. So I think as this evolves, we can certainly manage the influx of visits. And even if we're looking at some scheduled time, I know through talking to Jill, there were some, mentions of the Mondays, right? Everyone gets in and they're not feeling well. And then Friday before they go off to the weekend. So those are certainly conversations that we can have about specific times, not only intermittent times to see these patients and these kiddos, but also some scheduled time. So those are all things we'd be willing to work with you on if we move in this direction.
So Ellen, also from Marion, how would Rochester Regional Health help schools set up this telehealth process, and what types of support would they provide to our school nurses, who she is assuming would play a big role in this collaboration?
Yeah.
And while you're getting the answer ready for that one, I do just want to tell you that Jen mentioned possibility of running a school tool report, which is what we did in a couple of Wayne County schools. And depending on your, that is a great place to start as an individual school district. Like, again, if half of your young people are seeing Rochester Regional pediatricians, and then another 35% don't have a primary care position, then the pilot may cover, literally for some of our districts, it's going to cover 85 to 90% of the students, which is not a bad start for a pilot project, and can work on getting to 100% over time. But really, that data is something that each district can mine on its own, and glad to talk through the process that we used in a couple of districts to check out the feasibility for that work.
Great.
So then back to Ellen's question on what's the process for setting up, and what kind of support and nurse involvement.
Yeah, so certainly when it comes to nurse involvement is going to be key. As I mentioned, we are going to have to kind of work on that workflow, and whether that be, for example, partnering someone with Jill, and Jill knows from 11 to 1 p.m. she has dedicated time where she knows that she can line up a few students and be able to have them have video visits. But we'll take you through the training on how to use the equipment and how to take the student through the equipment. The providers on the other end will be trained up enough to be able to, if they're connected via video with the student, to be able to talk through them and let them know, this is how you use the peripheral so I can hear your heart and lung sounds, and guide them through that portion of it. So it really won't require too much hands-on of the school nurse. And then, our telemedicine team will help with the training. We can help with troubleshooting first tier issues. So if we ever do have an issue with the clinic, we can help with either whether it be internet connectivity or escalating that issue to our vendor, which is Tidal Care, on those. So we can certainly help with that. And, as we identify sites, Jay, I think it's a great idea to start with a few schools that, we have a school nurse who is excited about it, and we have a large population of students that we can start working with initially to start learning from and improving our process.
Cool. So Another question, how would billing work? Would there be a copay? Will this be available for all insurances?
Yep. So as of right now, the billing one, so obviously we'd be billing the patient's insurance. We would have, as of right now, we're not doing copays in COVID-19. So we'll kind of have to monitor how that changes after the pandemic, and where we go from there. But we'll basically be having to implement some process where the school nurse would identify a student who is a Rochester Regional student, and then we would have to do kind of a check-in similar to what we would do in the office, but we would have to do that virtually before the patient and the provider met in the Tyto clinic. So that's part of the process that we would have to iron out exactly how to do it. You know, probably the biggest sticking point in there is getting the parental consent forms that we need signed. So we would certainly probably want to partner with Wayne County, you know, to partner with you know, these schools that have a high population of Rochester Regional or Rochester Regional primary care patients, and first push out kind of a mass, try to collect these forms and get them signed by parents and needed parties. But so we would be able to, in general, if there are patients, we'd be able to pull from their insurance that they currently have on file, and be able to bill their insurance that has been provided. If they're new patients, we'll have to go through a little bit more of an extensive registration process. And we'll have to kind of map out what that will look like.
But that's also where, and more, I'm gonna bounce to you in another hat there, the Wayne County Rural Health Network. I think community schools may be able to develop a contract with Wayne County Rural Health Network, perhaps to help support the parent outreach and the parent engagement and the messaging. And we can maybe, we've got some really great outreach workers there that might be able to support a district or two during the launch period. That might be part of an implementation plan. I don't know if that makes sense or not, Maura, but.
Yeah, absolutely.
So districts wouldn't necessarily have to lift it all on their own. I also think that family counseling service, I think I could ask advocates for help, and, you know, engaging families there, and our out of school team. So it would be an all hands on deck sort of piece. The other question that I've got here, let's see, working through, Jill's wondering about documentation for a visit. Is that documentation kept by the clinician providing the care, or is it kept by the nurse? Who does the documentation for the appointment?
Hi, this is Dr. Olowski. I can talk to that. You know, we've been doing telemedicine since March. It was something that we were supposed to do one visit for the entire year, and I've done over 100. So we would be the ones who would be doing the documentation. She would just supply us with the chief complaint, and then we would go through and ask the kid all the questions about what's going on, their symptomatology that there's going on, and then we would do all the documentation because it would be part of our notes that we have in our system.
Very good. What about, got another, just a question about parents. And so a parent wouldn't necessarily need to be present for the visit.
So they would not need to be present for the visit, but they would have to provide a consent to allow their child to have a telemedicine visit. That consent can be signed ahead of time. So it doesn't have to be, I consent to my child today having a visit. It can be, I consent to my child having a visit when necessary in the future, but we would need that signed ahead of time.
And then that would be part of the process that the school would take about how do you keep the parent active, how do you keep the parent involved? And, you know, right. I'm wondering about the possibility for schools to be able to provide, I don't know what it's like to have two video things going on at once, but, you know, to perhaps, maybe it's even possible for, you know, maybe it's a discussion to see if it's possible for a parent to join remotely, or something that, you know, and on another screen, so that, you know, the parent could also ask their child questions and hear a little bit what's going on maybe, or provide, but I don't know what would work in different settings. But I do think that
Yep.
the parent involvement piece is something that we definitely want to. So having, let me give just one story of one young person. A family with a single mother, working elderly member of the family in hospice. 15-year-old arrives at school, having walked through the cold in the fall, and has a runny nose, and geesh, we're really nervous, right? Figuring out COVID symptoms. Well, the school, due diligence sends 15-year-old home, and is now asking for a COVID test. You got a single mom with an elderly member of the family in hospice, with a 15-year-old that can't go to school, that's under a lot of stress. And if I can't, we could sit all day and talk about what could go wrong in that situation. So if we could somehow make it possible for that young person to get immediate care, to lift the burden off the family, but somehow keep the family involved, how do we lift burdens without removing responsibility? How do we lift burdens without? Those will be really good questions. Those are important questions, because being a parent is hard, and it's not the school's job to make it easy. But inequity is real, and it is our responsibility, just as human beings, I think, to make life as equitable as possible and to make care as accessible as possible. So being a parent is hard, but it doesn't have to be inequitably hard, if that makes sense. Mm-hmm. And I think that's what we're really talking about, is how can we create equity? And equity of access is one type of equity. Mm-hmm. So Casey says in chat, many families I work with have transportation issues to reach specialty providers, especially developmental behavioral health needs. It would be great at some point to think how to provide these services and include parents as well. And that televisit, welcome to Rochester, and back is a long haul. So specialty visits as a potential growth area, is an idea. And Nikki Miller from Marion is asking, can you walk us through an example of a student coming with COVID symptoms to the nurse? How would that play out if they were an RRH patient? So I think we're looking for a case study here. You have a young person arriving that's got some symptomology that may be COVID related. What might a visit sound like or look like?
Yeah. Dr. Arlowski, do you want to talk a little bit about kind of how that visit would go from a clinical sense?
I mean, we would treat it, well, we would treat it like what we've been doing for telehealth visits. The one thing that would help a lot is if there is the ability for the nurses to do a COVID test, if they had the rapid antigen test, at least, even though that's not the best test out there, but if they were able to do the testing there in the office, that would help. Same thing with strep. I mean, if they're able to do rapid strep, that would be great. But we're also working into trying to find some way of a transportation using the RRH lab transportation that goes from office to office, picking up samples that actually, if we can do the nasal swabs or the rapid strep or throat culture in school, that we can have somebody actually pick them up, those samples up from the school, and take them back to our labs and have them run. But that's right. So this could be like any other video visit where we walk through the symptoms and hopefully be able to listen. This will be better because the video visits I do right now, I have no way of looking in the ear. I mean, they can shine a flashlight in their throat to see the throat, but I have no way of listening. This way I can actually listen and actually see their ears, see the back of their throat in a better situation, a more controlled situation. Whereas the televisits we do on the phones, they're not as great quality. And I'm hoping this will actually be a better quality for me for doing a televisit. So that's going to be the hardest thing, is the samples and getting the testing done. And hopefully we come up with a way of being able to utilize our traveling lab pickup people to come pick up samples from the schools.
You know, if they're on their way in and they could bring a sandwich from a nice deli out in Rochester, be great. I mean, they could do Uber Eats at the same time. I'm just thinking, sustainability. We're always looking to blend funding streams. So Nikki is adding a question here. What's the process when they walk in the door? What will the nurse have to do to set up an appointment, kind of thing? Like what's that What's the process look like maybe from the school side? So right now we know what we do. We call home, get a young person sent home. Instead, now we've got a young person that comes in. It happens to be a day we've got, assuming there's availability, that the scheduling and the logistics are set. Young person comes down or is sent down from a classroom teacher and says, hey, what then does the school nurse do? Or process for, I think, once they walk in the door or to set up an appointment is the phrasing Nikki's using.
Yeah, I think I don't have a great answer for you there, because I think that's something that we would need to collaboratively kind of come together and determine exactly what that process is. It would look something like, the school nurse determines that this child who walks in, is a Rochester Regional primary care patient or does not have a PCP, could benefit from seeing a provider now for kind of whatever myriad of reasons we kind of work together to define, then determines that child already has, or, we have a process defined for getting the consent form. And then, if we determine, and then is able to just kind of, we would be able to log them into the title equipment. So basically we'd have to, ahead of time, we would have to determine how to schedule. So it could be something like we give each school nursing office a few hours so that the nurse knows from 11 to 1, all she needs to do is sign in on the Tyto device and a provider will be waiting there, right? Or it could be more kind of schedule based, and we would just have to kind of work that out. But ideally, the process is school nurse identifies a good candidate for a video visit, for the same day video visit, shares the chief complaint with Rochester Regional, sets up a video after we've confirmed that we have the necessary consent forms, sets up a video connection, and then we'll do follow up with the parents in an agreed upon manner.
So that is, again, going to be place-based, depend on some buildings, nurse availability is a thing. So, some buildings, physical space in the nurse's office is a thing. So I think everything is going to be place-based and would have to put a team together. Jill had a question in regards to COVID strep. What would the school nurse do? Would the school nurse do the swab, or would the student be referred to a PCP office for the swab?
That would really just depend on whether the nurses actually have the ability to do them, because even if they do the nasal swab, that's what we're trying to set up, that transportation that we can actually pick up. If they do those swabs, we can pick them up and run them in our lab. So it's something we have to work out. We're working on the transportation people to see if we can get that done.
And I would just add that if we look at a couple of pilot offices to do this, we would work together with the space, safety protocols, right? I'm sure you already have, as we're all dealing with COVID regulations, right? Quite a few in place. So we would work with you with the pilot programs to figure out where we're gonna utilize the PPE, the space, and pick up from our labs and specimens and such. So a continued conversation.
So it sounds like the initial, the cost for districts is one of time and investing time to really work on how all this flows and connects. And it's not as much a dollar's cost so much as one of space and time. And if a district says we're ready to pilot it, like if I saw Jill's hand go up in Lions, that leaves 2 slots left. Who else? But seriously, if a district is ready to pilot that, what are the next steps for the district?
Yep. So they can reach out to me directly. I'll send my email with this slide deck. And I think we would just want, for the district, we would want to identify the necessary parties, and then we would hold a quick kickoff call, kind of go through which sites we've chosen, and work to define our scope and then work through kind of a quick project plan. The IT portion of it is small, but we do want to make sure that we've got the right processes in place to be successful, and that expectations are shared between both Rochester Regional, Wayne County schools, and the students that we work to get these video visits for.
And you said you have three devices.
Yep, we have 3 that are available in January, so we can definitely work to pilot something beginning in early next year. And we're certainly willing to work with you to maybe define something larger or increase the scope, as long as we're able to be successful with these 3, increase the scope for the next 2021 to 2022 school year.
Then are those devices, once they're at a location, are they pretty set? That's where they're going to be. They're not mobile.
So they can be moved a little bit, but it is an iPad on there, so we want to make sure that doesn't walk away. But it can actually be even like screwed down to a desk and nailed down, or kind of put down, or it can be something that it can certainly move within the building as well. So
I was just wondering if we had, say, 5 schools that wanted to try, and we got 3 devices, if it would be,
yeah,
from district to district, if depending on the scheduling or what. But
yeah, we could certainly move them if necessary, and may be able to come up with a few more too if we had 5 that were really interested. So we're happy to partner on that.
So I'm not sure if Rochester Regional folks were on the call as we started out, but I do want to let you know that we do have we were funded for Greater Rochester Health Foundation School Health Integration Project. And we'll start to roll that out a little bit in January by pulling some folks together to talk about what that looks like. And by March, we should have a 1.0 FTE on board to assist specifically with school health integration. Okay. And that would be somebody that could help a little bit with the lift of ironing out any wrinkles, and also working to see, we are very interested in certainly that unique clinical care, and that that ability to see somebody and get some symptomology addressed. But we are also looking to see what can we do universally to build health awareness and to build healthy habits, and to create really a continuum of care that is one of promotion and one of prevention, that has the ability to step up and climb the ladder of support when needed. Also, do just want to say that for the behavioral health piece, Wayne County Mental Health has a clinic, a designated clinic in every school building in Wayne County, and has been able to provide some telehealth services. And Maura and Jim have already talked about that a bit. There's been some connection there. So just any integration around that would just, I know that Maura will stay connected with Jim and make sure that all operates well. And Margie Tabor, I don't know, Margie, if you can wave. Margie's on the call. She's a community schools coordinator from Wayne County Mental Health. And we really are using the community schools model to look at how does this work in this place? How do we stay person-centered in this place? And how do we create a tiered continuum of support? And so I think that as we learn lessons in one place, they can transfer to another. And we're not looking to make every place the same, but we're looking to make best practices available to every place and have them select the ones that fit in their location. In some districts, for instance, even an elementary school may be set up very, very differently from a high school. And that ability to really look at how does this work here is an important question. So I really appreciate your time, and just looking for any, I think it sounds like the follow-up is to reach out to Cole, and Cole's going to give his email address. And then I'm just going to ask if you would CC me to keep me aware. Some of you later are going to be asking me for money for things, and I can help best if I know where you're going and what you're doing. So, you know, I'm just let me know what store you're in. I'll be the parent sitting at the kiosk in the mall, and you can, no, but anyway, if you could CC me, that would be great. And Cole, if you could let me know if districts do reach out. And Cole's email is in there. First one to email Cole gets the, no, I'm kidding. But we do want to really do a,
Jill
just
already
sent an
emailed
email
you
30
2 weeks ago.
seconds ago. Yeah. But we do want to really, we're glad to help look at that process. And starting, where do you start? Start with the students. How many of your students don't have a primary care physician? How many of your students is are already seeing primary care? And Brian's right that a deli sandwich does always increase chances, and coffee, you're a sure winner. I got to tell you for sure. So we did want to give folks time. We've got a little time in between the next segment. So I do want to give, I want to pause for just a second and give Rochester Regional a chance to share any closing thoughts. I want to make sure there's no other closing questions. Then I'm going to create breakout rooms for teams to have discussion, or folks can take a bit of a break, and we'll be back at 10:30 to talk about school safety. And appreciate Brian Pitt and Hennessy Lustica and Margie Tabor guiding us through school safety concerns. So it's Health and Safety Day here at the MTSS Roundtable. Rochester Regional, any other thoughts?
I just want to say thank you for the time, and obviously as we move forward with this project, we'll collaborate amongst each of you, right, with the school districts to what makes it easiest for you in collaboration with us. So we're happy to partner, and anything you may need, I'm sure Cole is going to loop me into those emails. We'll work with you.